Okay, the next device that we want to show you that we use here at Proline, this is our Derma Pin. And what this allows me to do is be able to penetrate our serums deeper into the skin. And with that, we get a faster turnaround time on building your collagen. So it's collagen induction therapy is one of the things that we're doing. And when we do collagen induction therapy, that's what's going to minimize our fine lines and wrinkles, tighten our skin. But one of the great things that we can do with this pen as well too is if we, any one of our clients have acne scarring, it will build the collagen back into those acne scarring and smooth that skin out. If you have keloid scarring, at the same time we can break those keloid scars down that's a result from acne or even maybe a C-section or breast augmentation. Great results with the Derma Pin with doing those procedures. And again with the stretch marks as well too, because you're building collagen back into the areas that it has been stripped away from. So what we do with the Derma Pin, this is the device right here. It does use microscopic needles. We put it into the end of it. This is disposable, so each client has their own disposable needle that we use. And
let's get a look closer.
What we're going to be doing with this is where the glasses come in here. We're going to show you. We have different depths on this so that we can penetrate into different depths of the skin. And I don't know, Jeff, can you see that on the end, the needles? I can take it out and show you, but 11 microscopic needles. So depending on what setting I have this on will depend on how deep the needles will come out. Okay. This down here is our speed. So when you hear this, this is how fast the needles will be going in and out. So this is basically like a procedure if you saw your husband out walking in the yard with his golf shoes on. He's trying to aerate the lawn so that the fertilizer will penetrate faster into the lawn to give you a greener lawn. So just kind of an example of that. But what we're trying to do here is add Celeste a little bit more hydration. She's doing well, but if we do this, I'm going to turn you just a little bit like this. And one of the great products that we use here of our SkinCeutical line that we carry is the Hyaluronic B5. And Hyaluronic carries about 1,000 times the weight of water as far as hydration. So it's a really, really great product to use. Our body actually produces hyaluronic acid to keep our joints moist and flexible. And so in the skincare line, we've discovered that it's great to use as a topical for feeding into our collagen, or to our fibroblasts that produce our collagen. So we're just going to simply use this. And the B5 that's a part of this as well too is for tissue repair. So when we're rebuilding our tissue, B5 is great for that. So we're just going to put a couple drops on Celeste's face here, just to kind of give us a little bit of a slide. And we're going to just kind of spread that around a little bit, get some topical hydration going here. Okay. And at this point, put my glasses on. Make sure that we are at the setting that we want to be for Celeste's cheeks. Okay, Celeste, we're going to get started here. You're going to really, again, pull your skin kind of taut like we were doing with the microdermabrasion. And again, what we're wanting to see is the pinkening up of the skin. So again, we're just going to do 3 little passes here. We're going to go in this area. We're going to go up and down. And we're going to come back and do some little circles. So the serum that I placed on Celeste's skin is now just being penetrated down a little bit deeper by doing this. Celeste, how are you feeling?
Fine. It's just like a light scratching. Very, very easy.
Very gentle. And one of the great things about this as well too, when is when we come back, we can also add an additional hyperpigmentation serum to let it soak in on some of a couple of Celeste's sunspots that I see that she's got going on here to help to minimize those. So again, just like the microdermabrasion, we're just going over the face, getting that pinking sensation. The results that we're going to get from using the Derma Pin on someone is the same as if you were doing anywhere from an IPL to a all the way up to a fractional type procedure.
Like a photofacial.
Like a photofacial. A fractional goes a little bit, it goes deeper. But as you know, when you're doing those type of procedures, you're doing them with lasers and with light, and it's a little more unpredictable because those use water in the skin to help to kind of to get the results that you're after, so you don't get even results with those procedures. And also you have a lot of downtime. When Celeste leaves here after doing this procedure, she's going to feel like she has a mild sunburn. We're going to give her some sunscreen to put on and just ask her not to do anything that's going to bring additional blood flow to the skin the rest of the day.
And with this, you can probably get a lot closer around the eyes and different things, correct?
Exactly. If you can see me, Jeff, I'm going to go right across this lip line here. This is one of the areas that us as women try to fight all the time and keep smooth. So I'm going to be able to smooth out Celeste's fine lines and wrinkles across her lip line there. It's get very close to Celeste's eyes. So with a laser, we're not allowed to do that. But with a Derma Pin, because these are just needles and we're putting serum in here, we're able to get right up underneath Celeste's eye here. We'll pull a little taunt. Celeste, you doing okay?
Mm-hmm.
And you're...
I feel it less under my eye than I did on my chin.
Mm-hmm. See how close we're able to get to Celeste's eye there. And I actually can even come up above underneath the brow line here. Tighten the skin up underneath here and work this whole area just really, really good. It is great for minimizing the pores on the nose, so we can actually go across the bridge of the nose to help minimize those pores on your nose that you have. Love, love, love this procedure. And as I'm working, I can see some of the areas that maybe I could need to go back over just a little bit because I want to make sure that I get that complete pinkness that I'm looking for with Celeste. You can actually go up here into the forehead area. And we're simply just going to go up and down. Minimizing these fine lines and wrinkles. Celeste will have a little bit of, again, a little bit of redness, a little bit of erythema when we finish the procedure with her. She'll definitely feel some tightness, but she'll feel very, very hydrated. After a couple of days, you might see a little bit of what I call kind of eraser type dusting on your skin, top of your skin. That's a little bit of the trauma to the very top layer of your skin. Not a problem. When you come back in to do another microderm, that will take that completely off. Again, this can be used with all kinds of types of serums. Basically finished with her Derma Pin treatment, and as you can see, she has a little bit of redness. Go ahead and turn this way just a little bit. A little bit of redness in these areas, but this again feels like a sunburn, and it will go away within basically about another 30 minutes to an hour or something like that. But this is what you look like after a treatment. And tomorrow when she wakes up, all of the redness will be completely gone. Totally back to normal.